second day of our Cancer Day Seminar Series 2022. Our today's topic is Cancer Management in Ayurveda, and it will be taken by our Honorable Faculty, Dr. Rajagopal K, Chief Physician at MB Krishnan Vaidya Memorial, SKVA Pharmacy, Kollam. And I invite Dr. Rajagopal K, sir. Will you, sir?
Thank you. Thank you. Good evening, everyone. Can we start?
Sure, sir.
Yes, sir.
Yeah, sure. So, hope everybody is doing good. Everybody is healthy with your families at home, safe and sound. As we all know, it's difficult times, and we will see how cancer goes in the next few hours. First, we'll start. Kerala is approaching or seen as a fast-growing cancer state. It is one of the fastest-growing cancer state in India. Why is it like this? Why Keralites are more prone to cancer? It's a very, disgusting question, but still it's a reality. Before we start with cancer, we'll see how many of you today, like the participants of the class, how many of you among you has cancer right here, right now? See, on a post-mortem study on road accidents revealed that about 40 to 50% of women who die of car accidents are actually contain microcancers in their breasts. Similarly, men who die in car accidents, up to 50% of them have microcancers in their prostates. Microcancers means the cancers are very small. That is, they does not increase in size because of the lack of angiogenesis or blood supply, and they are cleared off by the immune system when you are healthy. But what happens to these 40 to 50% of the participants in 10 to 15 to 20 years or 10 to 15 years, according to their genes and their habits? What happens is those who are having microcancers now will develop into bigger tumors in about 15 to 10 years, 10 to 15 years. And the lucky ones who do not develop cancer will see their loved ones, children, or spouses develop cancer. It's basically or virtually a cancer every home. 50,000 people die of cancer daily. That is more than any COVID or any pandemic will ever kill humans. By the end of this session, about 3,000 people will die or lose their lives or will not see their loved ones ever again. That is how serious the situation is. But what actually aggravates the situation is even medical professionals, not only Ayurveda professionals, but even the MBBS professionals have very little clue of how cancer works, or about cancer treatment, about how cancer develops in the body and it pathway it takes. This is because in our syllabus, medical syllabus, during the BMS and the MBBS and during the PG period, nothing is taught about cancer. Virtually, a health worker or a doctor is as a layman is about cancer. So in this state, it's very, very important that doctors are made aware of how cancer works and the importance of knowing more about cancer so that we can help our other people. So let's start. See, Matthias Schleiden and Theodore Swan developed the cell theory century back. According to this, all living organisms are made up of cells, and each cell always developed from a pre-existing one by division. We have all studied that. When we see cancer genetics, two types of genetic forces affect a living cell. One is the force of division, and the other is the force of adhesion. Two types of genes, especially oncogene and the tumor suppressor gene, are responsible for the division and multiplication of cells. So what an oncogene does is it regulates or it facilitates growth and multiplication of a cell, whereas a tumor suppressor gene, it suppresses this multiplication process so that total number of multiplications are regulated. But due to some genetic defects or due to mutations, due to environmental or genetic causes, when there is aberrations in the oncogene, what happens is oncogene actually overpowers the tumor suppressive gene, and the cell undergoes continuous multiplication without any resistance. And this develops in the form of immature cells multiplying in numbers, which eventually results in the formation of tumor or cancers in the body. So this is how basically how a tumor or a cancer is developed in the body. It is basically caused by mutations of the oncogene. Two types of factors actually affect mutations in the oncogene. These are the genetic causes and the environmental causes. Genetic causes are especially related to only about 5% of the cancers. Cancer is not completely genetic disorder. Only 5% of cancers are actually transmitted genetically. These are like intestinal polypoid tumors, breast and ovarian. Certain types of breast and ovarian cancers are examples of hereditary tumors. All other cancers, 95% of them develop due to various environmental factors, which may be food, habits, chemicals, and other drugs. All these contribute to mutation of the oncogene and development of a tumor in the body. So, according to the modern genetics, two types of proteins are responsible for the holding of a cell as well as for the multiplication and division of a cell. So, what does Ayurveda tell about Sharira and minute cells? In Charaga, in Chariram, 7th chapter, the famous Paramanu Siddhanta is explained by Charaga. Sharira avayavastu Paramanu vedena avarisankheya bhavati. Sharira is made up of innumerous number of minute particles called Paramanu. Adi bahutvad, adi saukshmyad, adindriyatvacha. It is very small. It cannot be seen by our indriya, but it can be felt as a mass. So Sharira is made up of numerous particles called the Paramanu. There are two basic forces that act on a Paramanu. These are the forces of Samyoga and the force of Vibhaga. Samyoga helps in the adhesion of Paramanu, whereas Vibhaga, it repels the Paramanu. What happens in Paramanu Samyoga and what happens during Paramanu Vibhaga? Tesham Paramanunam Samyoge Shariram Arambhyade. Paramanu Samyoga results in life, or the formation of Sharira is formed due to the adhesion or cohesion of, or the Samyoga of Paramanu. Vibhage Paramanunam Vinasharubam Janayatyastaha. When this Paramanu undergoes Vibhaga or separation, it results in Vinasharubam, or it results in the destruction of the human body. Whenever Vibhaga is activated in accordance with Samyoga, it results in undue replication of Paramanu, resulting in the destruction of the human body. Tesham Samyoga Vibhage Paramanunam Karanam Vayu Karma Swabhavascha. Three types of factors actually control the Samyoga and Vibhaga of a Paramanu. These factors are Vayu, Karma, and Swabhava. What is Vayu? Vayu, it's not air. It is the initiating factor or the potential energy which initiates the Samyoga or Vibhaga of a Paramanu. That is Vayu. Vayu, it initiates the Samyoga or Vibhaga of a Paramanu. It is the initiating factor. Second is Vayu, Karma. What is Karma? When you talk about Karma, there are two types of Karma. you know, like Ihaloka karma and Purva Janmakrita karma. Ihaloka karma is what we do in our daily lives. Manasika karma and Sharirika karma. The food habits, the diet you take, the habits you have, these are all Ihaloka karma, Sharirika karma. Whereas your thoughts, your stress, your tension, your happiness, all these form the Manasika karma. Together with Manasika and Sharirika karma, they affect the Samyoga and Vibhaga of a Paramanu according to Charaga. Another karma is Purva Janmakrita karma. I don't know if how many of you believe in past life. As a doctor, what I believe is, I believe in the fact of genetic memory. See, what is genetic memory? When if you have, like, you have heard of many fears, like fear of height, fear of arachnoids, fear of height is agoraphobia, right? For many of these diseases, there is no cause why a man or female develops agoraphobia. There is no relation or causes. It's unknown. What happens here is, if consider you have an ancestor way back, hundreds of years back, you had an ancestor who fell from a tree while climbing or fell from a roof. He fell down, he got injured, but he survived. Whenever such a traumatic incident happened, what happens is it gets coded. It's called a genetic coding of memory. It's genetically coded so that it helps in the survival of future generations. So when this happens, and when this ancestor has a kid, this genetic memory is transferred to the next generation. But we may not know about it. We may not think about it. You might have seen or heard about 5-year-old playing piano without piano training, or a 6-year-old kid reciting Sanskrit whom he had never learned or studied Sanskrit before. So whenever this coded memory of ancestors under favorable or unfavorable conditions, especially during stress or other related conditions, gets switched on, this switching on of genetic memory results in the expression of ancestral characters, which is usually seen as these situations like agoraphobia or unknown children playing piano without even having musical experience. All these are now termed or scientifically proven to be a part of genetic memory. Especially in India, the caste system was mainly job-based. So for generations, they were doing the same job. Like even from a smaller age, people used to do the same job generation after generation. So in India, especially, that transference of genetic memory is very, very easy, or it's very much seen around commonly. And this directly correlates with the concept of Purvajanma. And third concept, or the third factor that affects Samyoga and Vibhaga of a Paramanu is Swabhava. Swabhavo Nishpradikriya. What is Swabhava? Swabhava is something that doesn't change. What you get from your parents or from your mother, father, Bija Bhaga, that is which is transferred from your genetics, which cannot be changed. Swabhavo Nishpradikriya. That individualistic Swabhava is also responsible for the Samyoga and Vibhaga of a Paramanu. So these are the three factors that affect Samyoga, Vibhaga, and of Paramanu. And when you talk about cancer genetics, Sushruta has described cancer like as, what do you say, Kurvandi Mamso Ubachayam tu Shobham Tam Arbudam Shastra Vido Vadanti. It is a mass formed in the Mamsa. Gatra Pradeshe Kvajit Eva Doshe Sammorchido Mamsam Abhipradushya Vrittam Stiram Mandarujam Mahandam Analpamulam Chiravriddhi Avadam. It is formed as a vritta or a sphere or a mass which has great depth or mula. and it is formed as a part of Mamsa Dushti. This is how Sushruta defines as Arbuda, and it can be formed anywhere in the body. Gatra Pradeshe Vijit Eva Doshe. And how do you treat it? The first line of treatment is Shastra Vido Vadanti. Sushruta says all Arbuda should be treated as a Shastra, should be dissected off, and then do Lekhana Karma so that it doesn't recur. This is the basic principle of treatment in modern as well. So Sushruta considers Arbuda to be of 6 types: Svadena, Pittena, Kapena cha, Rektena, Mamsena cha, Medasa cha, in which Rektaja and Mamsaja Arbuda are considered as Asadhya. What is Rektaja Arbuda? Please do not confuse Rektaja Arbuda to the common term in Malayalam, Rekta Arbuda. It's not leukemia. Rektaja Arbuda is Mamsa Pundam, Mamsangure Rajidam, Ashu Vrithim. It is a Mamsa Pinda. Rektaja Arbuda is a Mamsa Pinda. How is it formed? Dosha Pradushta Rudiram, Sirastu Sampitya Sankocha Gatastu Abagam. The deranged dosha, along with the Rekta, forms voluptuous Sira, forming Mamsangura or Mamsa Pinda, which is Ashu Vridim, which usually by term Arbuda is Chiravritti. It grows slowly. But the only type of Arbuda that grows very fast is Rektaja Arbuda. And this is due to the increased angiogenesis and the Asugari Subhavada of Rekta. Rekta Kshaya Ubadrava Pididatva Pandur Bhavet Arbuda Pididastu. And what are the what happens when a Rekta Arbuda grows very fast? It undergoes angiogenesis very fast, it grows in size very fast and results in bleeding. Rekta, it results in bleeding due and causes Pandutva in the body. In Rektaja Arbuda, Pandutva or Pandu Swabhava is caused due to bleeding as well as an Arbuda Pida. That is what Sushruta explains specifically. Rekta Kshaya Ubadrava Pididatva, the Pandur Bhavet Arbuda Pididastu. Pandu comes because of the Rekta Kshaya Swabhava of the Rektaja Arbuda bleeding as well as a complication of Arbuda. So let us see, these Rektaja Arbuda are fast growing. It grows very fast. It is Asugari. It kills and it bleeds. Which types of Arbuda comes under Rektaja Arbuda? See, when Sushruta explains organogenesis in Sushrutam Shariram, he specifically mentions how organs are formed from different constituents. When you see the organs which are formed from Rekta or a Rekta Ulbhava organs, these include Yagrit Pliha. Yagrit and Pliha are Rektaja Ulbhava. Fuffusam or lungs is formed Rekta Fena Prabhavam. Right? Unduga is from Rekta Kitta, or from the Kitta of Rekta, Undugam is formed. Similarly, Vasti, Gudam, Stanam, all are formed from Mamsam and Rekta. Vrika is formed from Medas and Rekta. All organs which are formed in the body which has a Rektaja Ulbhava has the chance of developing Rektaja Arbuda in the body. See, this is very clear when you see the different Arbuda that you see in your daily course. Stanajam, the breast CA, cervical CA, lung CA, liver CA, the rectal CA, intestinal CA, all these are formed in areas with increased angiogenesis or vasculature. As a result, they all have 3 things in common: increased vasculature, they are extremely aggressive, they develop very fast and get metastasized very quickly, as well as they are asugari or causes death very quickly. All these arbudas formed in the areas of costa, breast, cervix, intestine, guda, or vrika, all have rektaja swabhava. Hence, they are easily metastasized as well as create death or related life-threatening conditions very quickly. So this is about Rektaja Arbuda. Sushruta also mentions how an arbuda becomes asadhya. Whenever an arbuda is formed in the Marma Pradesha, Uram or Nabi or Budam or Vasti Pradesha, or it's affected in a srotas, in a particular channel, which blocks like in the urinary tract or intestinal tract, Mahakosta, or it has achalyata, which is fixation, which it doesn't move. It gets fixed in the body. These are asadhya arbudas. Also, Sushila mentioned certain types of or forms of arbuda that are asadhya, which include adhyarbuda. Adhyarbuda is an arbuda formed over an arbuda. Dvindvarbuda, two arbudas formed in one same site. And especially Dvirarbuda. Dvirarbuda is one arbuda is formed, and as a sequel, another arbuda is formed either in the same spot or on another spot. Dvirarbuda is what we call secondary metastasis in modern oncology. It's baffling, right, to see text which is written 3,000 years back to have mentioned metastasis and secondary metastasis, as well as very clear-cut prognosis of how an arbuda can affect the body and what are the clinical prognosis of that arbuda rogi. These particular prognostic values are still used in the TNM classification and other modern classifications of arbuda. Usually in India, usually throughout the world, the most common type of cancer in women is especially breast cancer. Breast cancer is so common nowadays. Like usually in earlier times, women having breast, usually young women usually never get diagnosed with breast cancer. But even now, in 20s, 30s, 40s, people are getting diagnosed with breast and ovarian CA. Similar as the intestinal and colon cancer, as well as leukemias. All these are very commonly seen in your daily practice, as well as you come across these patients very often for advice as well. See, let's see, we'll talk about a bit about breast cancer. We'll see a few cases, how they are managed. We'll see about how leukemia goes, also lymphoma as well. I'll give you a briefing of all this so you get an overall view how we are managing cancer. First, we'll start with breast cancer. Breast cancer is the most common type of cancer in women. It's two types basically. Breast in cancer is divided in terms of anatomy. It's divided into two types: ductal carcinoma and lobular carcinoma. Ductal carcinoma, it affects the milk duct, and lobular carcinoma, it affects the lobules. And this is the basic classification of breast cancer. And in the ductal and lobular carcinoma, it's further divided into ductal carcinoma in situ and invasive ductal carcinoma. Ductal carcinoma in situ is carcinoma in the duct in situ, which is not spread to any other areas, which is encapsulated within the milk duct or the lobule. It is called carcinoma in situ. And fortunately, carcinoma in situ is very much easily curable by surgery and radiation, since it is not out of the box. Once the genie is out of the box, then it causes severe problems all over the body. That is what we call invasive ductal carcinoma and invasive lobular carcinoma, where the carcinoma is spread to other invasive areas, other muscle tissue or lymph nodes or similar surrounding structures. Unfortunately, invasive ductal carcinoma is the most common carcinoma among women, which is about 50% of all breast cancers are invasive in nature. And as a result, also the death rate and the metastasis value of invasive ductal carcinoma is very high too. Usually, you all know the basic symptoms of breast cancer. You know, the lumps, you may see lumps, you may see pus or oozing of fluid, you may see dislocation of the breast, you may see lumps, you may see a red, flashy, inflammatory signs. All these, if you see all these, you send people for a mammogram. And once a mammogram is taken and if there is abnormality seen, then we go for an FNAC or a biopsy. That is how you gradually get into the diagnosis of a breast cancer. once a breast cancer is diagnosed, the most important factors that affects prognosis is the estrogen receptor study or the receptor study as well as the genetic study. See, it's not like cancer and autoimmune treatment is not like protocol-based treatment. That is not possible in autoimmune and cancer. Cancer and autoimmune, the Nija Roga has to be treated individualistically, precision medicine, according to the genetic study, according to the person's various symptoms, how his habits and co-habits go. All these are taken into account in prognosis of cancer as well as autoimmune diseases. So the receptor study is, there are 3 types of receptors in breast cancer, which is estrogen receptor, the progesterone receptor, and HER2+ receptor. Estrogen receptor are those cancers which grow in the presence of estrogen. So when there is more estrogen, the growth grows faster. Similarly, progesterone-based receptors, when it feeds on progesterone, HER2+ is a genetic malformation which causes aggressive cancer. And the 4th type is triple negative, which are negative to all 3 markers. Luckily, the estrogen receptor and HER2+ receptors are very receptive to hormonal therapy, estrogen therapy. 10 years of estrogen therapy with tamoxifen, it has shown good prognosis, as well as HER2+ also has good prognosis with monoclonal antibody therapy. Whereas other breast cancers, which include the triple negative breast cancers, have much worse prognosis. Another study is the gene study, which is with particularly 2 types of gene, breast cancer CA1 and breast cancer CA2, which are responsible for hereditary ovarian and breast cancer syndromes. You might have heard Angelina Jolie doing mastectomy, even though she didn't have breast cancer. This is because she was positive for BRCA1 gene, and her mother also had BRCA1 positive breast cancer. So once your mother or a first line relative, mother, aunt, grandmom, anybody have a BRCA1 positive and have breast cancer before the age of 50, you have a chance of breast cancer up to 75 times. Similarly, to ovarian cancer, you have a chance up to 30%. If you have very firm breast, highly dense breast by nature, if you have a high estrogen progesterone level in the blood, all these can affect your prognosis with breast cancer. See, breast cancer is like cervical CHS, a very taboo in nature. Women usually doesn't like their breast and vagina examined because of the various social norms and the misconceptions that has been present in society. But even if women are, society is ready to see and examine breast and vaginal examination regularly, up to 50 to 60% of deaths due to breast cancers can be prevented just by basic common examination and medical diagnosis. How does Ayurveda see breast cancer or the formation of tumor in a body? As you all know, in Sriroga, many types of Vidradi are said, right? Sthana Vidradi is a type of Vidradi said by Sushruta and Ashtanga Hridaya. And they have clinically well-defined Samprapti. But the most important Samprapti in tumor, especially in breast and other organ-related tumor, is said by Kashyapa. Kashyapa in chapter 19 has described a disease called Sthanakilaga. It's a very magnificent disease said by Kashyapa. There he explains the concept of Vajra. What is Vajra? Trishakashta Loshtadi, that is Trina, the grass or the bony particles or the metals or minerals that can get ingested, or the foreign bodies that help or get ingested are considered as Vajra. And it results in a foreign body reaction in the body. The reaction of the foreign body is said as the Samprapti in Sthanakilaga by Kashyapa, when Sudiga or Dhatri ingests Vajra, any type of Vajra, it's a foreign body, it doesn't get digested with Ahara Rasa. As a result, Ahara Rasa forms an ama with the Apachyamana Vajra. This Apakwa Vajra and Ahara Rasa, which is Viklina, it gets, which is undigested, it gets uprooted from the intestine through blood, along with Ahara Rasa, through by Vyana Vayu. Along the blood, it reaches the Stanavaha Srodhas, results in the formation of local inflammation as well as systemic inflammation. Local inflammation results in the formation of breast abscess, inflammatory breast, swelling, red color pus formation, etc. Classical signs of breast inflammation, mastitis, etc. As well as other inflammatory signs like fever.
Yeah, precise calculator.
As well as inflammatory signs like fever, dysentery, diarrhea, which has a systemic manifestation. So, what is this Vajra in the modern world? Is there Vajra present in the modern world? Is there a Samprapti which causes diseases in the body by the reaction of Vajra or foreign body in humans? The most relevant theories in inflammation as well as cancer directly link cancers to the more number of inflammation present in the body per day actually facilitates or increase more of inflammation results in mutations in the body as well as a disruptive immune system. So more number of inflammations you have per day, the chance of you developing a mutation or an autoimmune disease increases. So what are the causes or chances which causes your body to get inflamed? Is there any particular source? The most important source of inflammation for your body is absolutely food. Food is the number one cause of inflammation in the body. There is a range of foods called pro-inflammatory foods, which are especially important in oncology as well as the health of a human being. These are called pro-inflammatory foods, which actually causes inflammation in the gut. And this gut inflammation results in the formation of body antibodies in the blood, which get migrated to the breast or the pancreas or to smaller joints, causing minute inflammations and antibody reactions, resulting in mutations of musculature as well as vasculature. Three types of food especially causes inflammation in the body. These are gluten containing foods, second is red meat containing foods, and third is dairy containing foods. What is gluten? Gluten is protein that is present in wheat, rye, barley, etc. Especially in wheat, maida, atta. In your chapatis, roti, naan, the biscuits, bun, Maggi, pizza, burgers, all these contain gluten. What happens is when you ingest gluten, gluten is not digested by the human gut. Human gut doesn't have the ability to digest gluten. So when you take gluten enters when you chew and it enters the stomach and it gets partly digested and it enters the intestine. Since the gluten, it's a protein which is not digested, it causes the rubberiness in maida or rubberiness of the dough is caused by the binding force of gluten. And what happens, this undigested gluten in the gut, it causes the intestinal villi to open. Whenever gluten enters the body or a foreign body enters the body or intestine or a gut, what happens is there is an increase in serum zonulin level. Serum zonulin is an enzyme that controls intestinal villi. So whenever gluten enters your gut, intestinal villi opens up. And what happens, this undigested food waste along with gluten and other chemicals seep into the bloodstream through these intestinal villi and it enters the blood. Once it enters the blood, it results in a huge inflammatory reactions in the gut as well as in the vasculature. This autoimmune reaction is carried throughout the body. If you have a genetic susceptibility or somewhere, if you are susceptible to diabetes, or if you are susceptible to arthritis, or if you are susceptible to breast cancer, what happens is, in those susceptible areas, these autoimmune reactions are aggravated, resulting in chronic inflammation and gradually resulting in mutations and autoimmune diseases like diabetes, thyroiditis, or cancers. So you might have a doubt, why gluten? Godhuma and Yava are said by Charaka to be given to Prameha Rogi, right? Then why is this doctor saying gluten is bad for diabetes and bad for your health? See, Godhuma is not gluten. Godhuma is traditional variety of wheat. After the Green Revolution, and after the 1960s, what happened is genetically modified crops came into being. So before the indigenous variety of wheat were present in India, North India, as well as in Afghanistan areas, the total amount of gluten was only 3%. Whereas the genetically modified crops, which are seen all around the world now, has 20% of gluten in it. This change is a result of the burger, pizza, and cake industry, who want increased amount of gluten for binding their dough. As a result, the amount of gluten in your diet has increased from 3% to 20%, and gluten is seen everywhere in the Cadbury's you eat, chocolates you eat, the pizzas you eat, the burgers you eat, the the roti, naan, all contains 20% of undigestible gluten. So when you eat a chapati, 20% is gluten. This 20% causes irritation in your gut. It causes opening of intestinal villi, resulting in chronic inflammation, resulting in the aggravation of diabetes, thyroiditis, other autoimmune diseases, as well as resulting in cancer over a long period of time. Meat contain undigestible proteins called Mu5G, which has a foreign body in the gut and causes the same reaction like gluten. Third is dairy products. Dairy products is like the milk, curd, paneer, all those fermented milk products. They also act the same way. The cow antibodies, as well as the amount of antibiotics present in dairy products in India is unregulated. The most common disease for a cow is mastitis. So for industrial production, to avoid mastitis, what they do is 24-hour drip of antibiotics. And the increased antibiotics get concentrated in cholesterol in milk, and it is seen in highest concentrated in milk and milk products. As a result, increased antibiotics as well as lactose act as vajra or foreign body in your gut, resulting in chronic gut inflammation as well as resulting in other autoimmune disorders. This is how from your daily eating. See, when you eat, go into a KFC or a McDonald's, you eat a burger along with a shake. The burger bun is gluten. The padding is processed meat. Please understand, processed meat, that is red meat, which is processed by sausages or any processing, is in par. If there are carcinogens, WHO has grade 1, grade 2, grade 3 carcinogen. And processed meat is a grade 1 carcinogen. What is a grade 1 carcinogen? Other grade 1 carcinogens include tobacco and asbestos, as well as plutonium. Please hear me, plutonium. Plutonium is in par with a McDonald's burger. See, when you give your child parota, beef fry, and a cup of milk, it is in par with feeding your baby or child with a bar of plutonium. That is how dangerous this is. And in a normal Indian diet, not the traditional one, especially nowadays, the medical fraternity, the fast food culture, the amount of gluten intake, red meat intake, and dairy intake has gone up by more than 100%. Daily you eat gluten, dairy, and meat products daily, and as a result, in 10 to 15 years, all the micro cancers that you have now will develop into tumors and cancers in 15 to 20 years. That is why Kerala is becoming the cancer capital of the world. Now we will see how treatment, how different types of modalities of treatment we can see in breast cancers as well as in other cancers. It's a case, 75-year-old lady that came to me. She was from Kozhikode, Calicut, from a very poor family. She was 75 years old and she had a lump in the breast, but she didn't mind, and gradually it became an ulcer. And once it started ulceration, other lymph node enlargement started. Then she went for a scan and it was diagnosed as invasive ductal carcinoma, 4th stage with metastasis. So there was no, she was not healthy for any other treatment, and she didn't have the economic means for other treatments as well. So she came to me, she came here, she was having an oozing ulcer, as well as ulcer and pain was one problem. But the main problem was she had a metastatic lesion in her liver. The liver metastasis has resulted in anatomical partial block of the bile duct, which is causing obstructive jaundice. And there was an increase in progressive increase in Kamala bilirubin from 9 to 10 to 15. And she was having huge abdominal distension, other Kamala related issues, indigestion, nausea, vomiting, all Rishta Lakshana, Kamala Rishta Lakshanas. And this is one patient. And another breast cancer. This is a 55-year-old lady. She was diagnosed with a breast CA without ulceration, but she had a lung metastasis. Tumor was seen in her metastasis in her lung. And in her lung, it was causing blockage of lymph and other lymphatics, resulting pleurisy. She was having pleurisy. She was having difficulty in breathing because of the increased pleurisy in her lungs. And the third case is a 55-year-old from Palakkad. She was having breast CA, but she went for chemotherapy. What happened was she had a huge reaction to chemotherapy, and she lost all her hair, all her, she became very black because of the reaction, completely burned up. Her body was, she couldn't eat, all her mucosa was burned up, she couldn't eat, she couldn't sleep. She was having extreme anxiety as well. So 3 different patients, all having invasive ductal carcinoma, but 3 very different stages of their diseases. In all of them, the Pradhana Roga is Arbuda, but the Ubadrava Roga are completely different. In the first one, the Ubadrava Roga was Rudhapada Kamala. In the second, the Ubadrava Roga was Urastoya or pleurisy. In the third one I'll explain later. First, we will see the first case. So she was having increased Kamala. So she was basically, how did her Samprapti came into being? First, she developed inflammation of the breast. So she developed an abscess, which is Stana Vidradi. And because of this Vidradi, it resulted in Shobha, then ulceration Vrana to Arbuda. That is the Samprapti. And this Arbuda, once get metastasized to the liver, there she formed liver mets and related to Kamala Pandu Rishta. So she was having Kamala Rishta, starting with Stana Vidradi to Kamala Rishta. She was going to die very soon because of the obstructive jaundice. So here the Pradhana Roga is not Ashugari, but Ubadrava Roga will cause death very quickly because she was showing signs of Rishta. Rishta is very important in cancer treatment because unless you learn to diagnose Rishta, you cannot cut the Ubadrava Samprapti. or provide proper treatment to cut off the samprapti to save a patient's life. Here, how do you treat the patient with Rudrapada Kamala? What is Rudrapada Kamala? Tilapishta nibham yastu kamalavan srijan malam kabham Rudrapadam tasya vittam kabhare jayet. What are the signs that a patient has Rudrapada Kamala is the stool becomes tilapishta nibham, like the paste of tila. When you paste tila, you get a very light color, not stool. The color of stool is yellowish because of the lack of bile. Stool becomes more whitish. That is tilapishta nibham. And this is caused due to kabha rodha. How do you treat Rudrapada Kamala? Sab bija puraga rasam lihyat vyosham tadashrayam. You give bija puraga rasa with vyosha or trikadu to clear off the tract. This is the classical treatment for Rudrapada Kamala. How can you adapt this? Can we adapt this treatment in a 75-year-old patient who is having or showing Kamala Rishta? It's very risky and it is not possible. But here we didn't have any choice. Usually what we will do is we send the patient to put a stent operation so that the bile flows to the cavity without obstruction. But stenting was not possible in this patient because of her weak body conditions. Hence, we had to do. She was given Haritaki and Nimba Wada along with Kaishora Gugulu. Then she was given Panchagola Churna along with pomegranate juice. Sab bija puraga rasam lihyat vyosham. Classically, vyosham is trikadu is maintained, but Panchagola has more shobhara property than trikadu and helps reduce shobha or inflammation in the digestive tract because she was having slight ascites also. Hence, Panchagola with bija puraga rasam, pomegranate juice was added. And for her Vrana, Madhukadi Thaila Sedina Ashtanga Hrudayam Bhagandara Chikitsa was used for dhara as well as dressing. And once the treatment was started, and slowly what was seen was her stool color started to be more yellowish, and her abdominal distension as well as pain of the abdomen started reducing. Her pain of the ulceration started reducing. This woman would have died in 2 weeks, usually with Kamala Rishta. But fortunately, with this treatment, the Kamala was cleared off completely. And after 1 month, her bilirubin level was normal. And this was done like 1 year back, and the woman is still alive. She is not supposed to be alive, but she is alive. Rudrapada Kamala Chikitsa, how do you know when you give Panchagola that the symptoms get alleviated? Sampittam tena asya shakrit tapyanurajyate vayischa yadi prashamam sa adoba ubadravai nuvartubadravasya karanam kamali goviti. Once the obstruction is revealed, the stool color changes to yellow. Abdomen vayu related symptoms, adoba matmanam related symptoms reduces in size, as well as once the Kamala is completely controlled and the patient is relieved from Kamala Rishta, you can go for Arbuda Chikitsa. Once the Kamala was completely cured, then we started with Arbuda Chikitsa. She was started with the Resaganti Medical as well as Gugula Tikta Kashayam, along with Kaishora Gugulu as well as Ugra Nagaradi, which is a traditional yoga used in Rekta Gulma Chikitsa, which is also given for her. And the second case in which the patient had a lesion in her lungs. Because of this lesion, she was having pleurisy or water retention in her lungs, causing swasa. She was not able to breathe properly, as well as she was having vomiting sensations and other problems. For her, here, the samprapti would be like Stana Vidradi abscess, followed by Stana Arbuda, followed by pleurisy or Urastoya. What is Urastoya? Ura is chest, Toya is water. In Bhava Pragasha, there is an adhyaya named Urasthoya Adhikara. It particularly mentions the treatment of Urasthoya. It is particularly mentions that treatment should be Mutrala, Kapavadahara. In case if Pitta is present, Pitta or Pitta Prathana pleurisy is present, Pitta Rekta Prathana pleurisy is present, then treatment has to be for Pitta, then Tridosha Samana. Here, the patient was suffering from Shwasarishta. She was having Shwa because whenever your Udana and Prana Vayu is blocked by Kapha, or here in this is Kapasthana, and Udana and Prana is blocked by Kapha and Ambu. As a result, Shwasarishta is progressing very fast. At this stage, the treatment was given for Urasthoya because it is the Pradhana Upadrava. For her, Agragrahya the Kashaya, which is a traditional yoga which was said in Sahasra Yoga, not the present print, the old Sahasra Yoga, it was present. So Agragrahya, it contains about 60 to 70 medicines. And the classical treatment of Urasthoya is Punarnava Kvada. Punarnava is Borrevia diffusia Talidama. And this Kvada was given with Chavarkara, with Shara. That is the classical treatment mentioned in Bhava Prakasa. And she was also given Agastya Rasayana with pinch or 250 milligram of Kalyanaka Kshara. This was given for her so that in time, after 1 week, her swasa or difficulty in breathing reduced. And in the X-ray, her pleurisy, amount of coverage of pleurisy reduced. Her overall symptoms reduced, and once the symptoms reduced, then we started with Arbuda Chikilsa. Here she was having under Vitradi. Vitradi Chikilsa has to be manifested. She was given Sugumara Kashaya as well as Sugumara Grida along with Rasa Sindhura. She was also given Abhraga Basma as well as Sorna Makshika Basma. Sorna Makshika and Abhraga. Abhraga is a direct indication of Rekta Bitta, so Sorna Makshika is a direct indication of Grandhi Arbuda. It was given with honey twice daily. And in time, what happened is her liver mass, the lung mass, the pleurisy gradually weaned off, and her Arbuda mass, metastasis was reduced as well as the spread was reduced. And she was able to breathe properly. She was, her mass in scan, the mass or the growth of Arbuda was nullified. And she's alive even now after 1.5 years. And this was the treatment of Urasthoya Arbuda. And the third one is what I said, the complications of chemotherapy. Whenever you do induction chemotherapy, especially in aggressive tumors, in induction chemotherapy, there are 2 types of chemotherapies, induction chemotherapy and palliative, which is for curative purpose, and palliative chemotherapy. Induction chemotherapy, we use high amount of strong drugs are given in a short interval to kill off the cancer cells as well as the other cells. So what happens in induction chemotherapy is everything in the body gets burned up. And most of the people or persons cannot tolerate this. And as a result, their completely body hair was, she was like 60-year-old from Palakkad. She was a Malayalam school teacher. She was retired, and she did chemotherapy because there was no choice for her. But she had a huge reaction with induction chemotherapy, and she lost her hair. She became so blackish in color, and she was Prithak Pragoba everywhere. As well as she was sleepless. She couldn't sleep because of the anxiety as well, and she could not digest properly. Can you relate a disease like this, having Haridashyava Pitatvam, having high Vada Pitta symptoms, said as a complications of Pandurishta? It is Halimaga. Yes, you have guessed it correct, right? Halimaga. Haridashyava Pitatvam Panduryoge Yada Bhavet. Vada Pitta Pramatrishna Strishu Harsha Jvara. Tandra, Bala Anala Bramsam, Lotaram, Tam Halimagam. So she was having all classical symptoms of Halimaga. The first time I saw a Halimaga patient was when I was 13 years old. the patient was suffering from leukemia. For a leukemia patient, leukemia is basically Pitta Pradhana Roga. It is a complication or Rishta complication of Pandu. Pandu Sambrapti. Pandu Rekta Pitta Rishta is leukemia. So he suffered leukemia. He was having M4 leukemia, which is very, very aggressive. And I was like 13 years old. And this happened to be my father as well. And he was diagnosed with leukemia. And during that time, the induction chemotherapy was very, under experimental stage. Even now it is in experimental stage, but that time it was very, very experimental. And he was given induction chemotherapy, and he had a huge reaction to the induction chemotherapy. I didn't know this. So when he came back after treatment, he was in a wheelchair, and I was like 13 years old. And when I saw him, I was like terrified. He was like a fair guy. And when he came back, he was full black, like totally black. He lost all his hair, completely burned up. That was the same symptom that this patient also had after a reaction of induction chemotherapy. She was having Stanavidradi, Stanarbuda, due to increased chemotherapy is nothing but Pitta Prakopa Chikilsa. So increased Pitta Kopa results in Pandu Halimagarishta. When there is Pandu Halimagarishta, what is the Chikilsa? Guluchi Sarasa Kshiram Sadidena Halimagi. Mahasiha Vishasritnam. The treatment for Halimaga is Guluchi Swarasa. She was given Guluchi Adi Kashaya along with Chandraprabha, along with Guluchi Sattva and Guluchi Swarasa. As well as she was given Amalagi Prasha, Dhatri, because Dhatri is a direct treatment for Halimaga. And she was given Tiktaga Grida along with Triphala at night 7 p.m. So she was started with this treatment as a complication of Halimaga, because Halimaga was the Pradhana, Arbuda is the Pradhana Roga, and she was showing Halimaga Rishta. That is why Halimaga Chikitsa was started here. Once her Halimaga was completely cured, then we started her with Arbuda Chikitsa. So 3 same invasive ductal carcinoma, 3 different sambraptis, 3 different mode of treatment, 3 different prognosis, all treated to show better results with different medicines. What is this? This is what we call in modern as precision medicine, treating according to our body's genetic as well as environmental need specifically. This is what we differentiates it with protocol-based treatment. In a protocol-based treatment, it is usually done in community medicine. Like when you have a community spread of corona or a bug or a virus or a bacteria, you can give the same drug to 100 people and give a take a research methodology. But in Nija Roga, our treatment including diseases of the autoimmune nature and Arbuda, we cannot give the same drug to 100 people and expect to have the same result. That is stupidness. That is absolute stupidness. That is why Acharya has mentioned Sambrapti Vigadanam Chikilsa. Unless you know the Sambrapti of a Roga, you cannot treat it with precision. Sushruta especially mentioned a Vaidya should be like an archer. He should hit the target specifically every time. In Arbuda Chikilsa, we don't have Upasaya and Anupasaya because an Anupasaya kills the patient. I am repeating. If you give an Anupasaya to a cancer patient in Rishta, the patient will die. The family will lose a person. That is why Samprapti Vigadanam is very, very important in cancer treatment. How next we will see protocol and precision medicine. I was invited to the All India Institute of Ayurveda in New Delhi by the Ministry of Ayush to train the doctors of and the professors of All India Institute to help them manage the cancer treatment patients that were coming there. So I have to practically teach them from scratch how to manage each cancer, as well as to develop a protocol, so that we actually took 3 days of intense protocol as well as discussions to come up with protocols for the whole of the nation in India. Especially leukemia was a particular point of reference in these meetings in New Delhi. And there also the same problem came. In leukemia, different people will have same leukemia, but they will show different different symptoms, different chromosomal activity, different genetic manifestation. So we cannot treat every leukemia patient as one. And we decided in New Delhi to provide with individualistic protocols for every patient. That is how we have planned to do protocol for the whole of India, whole of nation, from All India Institute of Ayurveda, especially in leukemia. And when you talk about leukemia is a very, very, enigmatic cancer. It is not like other cancers. Leukemia happens due to the mutations of pluripotent stem cells in the bone marrow. What happens in the bone marrow is, there are stem cells which helps in the development of WBC, RBC, and platelets, which are the blood components. When the bone marrow cells get mutated, it results in the formation of abnormal WBC, RBC, and platelets. And cancerous WBCs, they infuse or fuse in the blood. This is infusion of cancerous WBC is called blast crisis or increased blast in the blood. This condition is called leukemia. More than 20% of blast cells in blood is called acute leukemia. Less than 5% of blast or cancerous cells in blood, it is called myelodysplastic syndrome. Acute leukemia, it is much more fast moving and it causes imminent death very fast. Whereas myelodysplastic syndrome, it is much more a chronic condition. Eventually, it will enter into blast crisis and cause acute leukemia. There is one case which has affected me very personally. This was a kid. His name was Ryan. Ryan was a 2-month-old baby when he came to see me. 2 months, just imagine, 2-month-old. His father was a dental surgeon from Kasaragod. They were settled in UAE. And once the baby was born, after 2 months, the baby started forming red rashes in the skin. He was having intermittent fever. So blood tests were done and they saw increased WBC count, 3 lakh, 4 lakh WBC count. As a result, they took him to RCC Regional Cancer Center in Trivandrum. They did the biopsy and they saw that they thought it was acute lymphoblastic leukemia seen in children, which is the milder variety of leukemia, which is very responsible to chemotherapy as well. ALL is the only leukemia which is responsive to chemotherapy. All other leukemias, acute leukemias, are not very responsive to chemotherapy, and which usually results in relapses and death in 3 to 1.5 years. So this Ryan, when he was chromosomal study was done and other biopsies was done, he was diagnosed with M5 monoblastic leukemia, which is a very, very aggressive leukemia, one of the most aggressive leukemias in the world. They cannot be even cured with any induction chemotherapy, because usually with this kind of WBC input, as well as Ryan had a 90% of blast in his blood. 90% of blast is like 90% of blood components were cancerous. And he was showing signs of bleeding from his gums and reddish stacks riding out, and internal bleeding was started. And RCC, they said they couldn't do any chemotherapy or any treatment for that matter, because he was only 2 months old. And they said they rejected the case from RCC. And they said the baby would live for maybe 10 days maximum. That was the condition when Umar Sheikh, Mr. Umar Sheikh, Dr. Umar Sheikh, actually my friend, came to me with the 2-month-old Ryan. And there was no chance. And he asked me, doctor, this is my youngest kid, and I haven't even seen him for 2 months, and she's going to go in a week. What I want to do is to extend his life for at least a month or 2 months. That is what he all wanted. So we started treatment. Leukemia, as I said, it is Pandu Rektapitta Sambrapti. I'm not going to explain Pandu Rektapitta Sambrapti right now, because it takes lots of time to explain Pandu Rektapitta Sambrapti, and it's beyond the scope of the discussion of this magnitude. So Pandu Rektapitta Sambrapti was initiated, and we started the treatment. And in 10 days, when we took the blood picture, his WBC count reduced, his blast cells, cancer cells, reduced from 90% to 50%. And the red eruptions in the body started to subside. After 3 weeks, everyone was surprised the kid was alive. The WBC or a blast reduced to 10%. Platelets and other blood components normalized much better, and all his red rashes, bleeding tendencies, intermittent fever, everything was subsided. And after 3 months, blast was nowhere to be seen. He was in clinical remission of M5 monoblastic leukemia without any conventional treatment. That has never happened ever in medical science. That is the significance of this case. And this was discussed along with another case in All India Institute of Ayurveda for promoting individualistic, personalized, genetic-based treatment for every autoimmune and cancer patient. This case was taken as a clinical standard. And what happened is, Ryan continued with his medication. After 1 year, he was healthy. He was moving around fine. There was no fever. He was growing with all his milestones. He was hungry. He was eating, having proper weight. After 3 years, the medicines were continued. After 5 years, we did total checkup. Cancer was nowhere to be seen. And today, now, Ryan is 10 years old. He is 10 years old, completely cured of monoblastic leukemia, M5 leukemia, without any conventional treatment, from a near death, 95% blast crisis. This is what you say, a miracle. How did we treat it? We treated with Pandu Chikilsa, Pandu Alimaga Kamala Rishta Chikilsa, Pandu Rektapitta Samprapti it was. And similar, another case is the, I said before, Myeloid Dysplastic syndrome. This was Manab Sakya. He was from Assam. He had Myeloid Dysplastic syndrome, which is a pre-leukemic condition in which the blast cells is less than 5%, but he was having platelets, diminished RBC, WBC, and platelets. His HP count was around 5 or 6. Platelet count 8,000, 9,000 range, and diminished RBC as well. And he was doing 10 to 12 blood transfusions per month. He was diagnosed in Vellore, undergoing treatment in Guwahati as well as Tata Institute. They had no other treatment other than stem cell transplant, but it had a very little chance because of the myelosuppression and chromosomal anomalies seen. And he didn't have the financial to do 10% or 5% success treatment for a bone marrow transplant. And he was financially weak, and he was losing weight, his family, and he was having anxiety and all other problems. He had a bleeding tendency because his platelet count was continuously down, and he had to do blood transfusion every 10 to 12 blood transfusion every month. These are two parallel cases. One where cancer has reached 95% blast crisis, other only 5% blast, but the same sambrapti, having Pandu Rektapitta sambrapti. One is leukemia and other is myeloid dysplastic syndrome. One is a child and other is an adult. Child showing classical signs of Pandurishta, and the adult showing classical signs of Rektapitta Rishta. Here the treatment was done. For Ryan, he was given Kalyanaka Ghrida along with Haritaki Churna. 1/4 teaspoon of Kalyana Grida along with 1/4 teaspoon of Haritaki Churna was given. He was given Amaleki Prasha as well as Drakshadi Kwatha was given twice per day along with Loha Abraga and Swarnamakshika Basma 50 milligram each along with what do you say? Honey. Why Kalyana Grida? Panduamai Pibel Sarpiradau Kalyana Gwahayam. Panjagavyam Mahadiktam Sridam Va Aragvadadinam. Kalyanaga is the first choice of drug in Pandu. Here, his HP was very much down. He was WBC, RBC was out of the roof. He was having Rektakshaya. Rektakshaya is the classical sign of Pandu, and he was showing Pandu Rishta, going towards Rektapitta Samprapti. He was having Agni Mandya. Since because of the Agni Mandya, he was producing immature Rekta or Apakwa Rekta. Apakwa Rekta is a sign of Dhatu Agni Mandya. Because of Dhatu Agni Mandya and Apakwa Rekta, Vada Kapahara Kalyana Grida was included. Because Kalyana Grida has Agni Vardhaka property as well as Pandu Rektapittahara property, and it is a magnificent drug. Why Haritaki Churna Shuddhascha Ubedo Likhyat Patyam Madhu Grida Druda? In Ashtanga Hridaya as well as in Charaga, after Ubhaya Shodhana Chikilsa, the first choice of drug in Pandu is Haritaki. Haritaki is Kapapadhara, Rektapittahara, Arbuda Grandhihara. Hence, Haritaki was chosen to be given with Kalyanaga Grida. Why Loha and Abraga Basma is given? Loha Basma, as you know, is classically said by Shrusuda should be given for Pandurogi. When to all Pandurogi, it can be given with Triphala or with honey or with Gomutra or anything. Here, Triphala, Loha, Abraga, Swarnamakshima, Basma was given with honey. Whereas, you see this case, this was the medicines given for Ryan. He was suffering from leukemia. And next is, I said, the myeloid dysplastic syndrome. Here, he was suffering from platelet reduction, increased bleeding tendency. He has Rektakshaya, particularly Pandu, along with Rektapitta, Vadapitta, Vardha, Swabhava, with the Rektapitta Rishta. Here, he was given Tiktaga Grida. Why Tiktaga Grida? As you said, Panduamai Pibel Sarpira Ado Kalyanagahayam Panchagavyam Mahatiktam. Mahatiktam is given in Paitiga Pandu with the Rektapitta Rishta and also with the showing inflammatory conditions of, he was also having anxiety and sleep disorders. Paitiga Unmada, Paitiga Grahani, as well as in Pitta Abhishanda Chikilsa, the choice of drug given by Ashtanga Hridaya Charaga, all is Tiktaga Grida. Pitta Grahanya Tat Peyam, Pushtoktam Tiktagam Chayam. In Paitiga Unmada also Tiktaga Grida, in Paitiga Jwara also Tiktaga Grida, as well as in Paitiga Abhishanda, Timira, eye problems also Tiktaga Grida. That is why he was given Tiktagrida along with Haritaki Churna. He was given Gandhira Rasayana. Sorry, he was given Amalagi Prasha one time and Gandhira Rasayana other time. Gandhira Rasayana is made here with indigenous Gandhira as well. Amalagi Prasha, we make Amalagi Prasha from indigenous Amla only. It is much more potent than the other Amla we used in mass production. And we use only, what do you say, high quality medicines as well as preservative free medicines in cancer treatment as well as treating autoimmune diseases. And Manan, the myeloid dysplastic syndrome, in 2 months, after 1 week of taking the medicines, his platelet count increased from 8,000 to 25,000. His HB increased from 5 to 8, and his RBC was corrected as well. And after 1 month, his HB increased to 10. Platelet count become 50,000 and RBC normalized as well. And gradually his condition was maintained and no blood transfusion was done after the starting of medicines. And after 7 years now, after 8 years now, Manab has never done a transfusion after starting medicines. Treatment was continued for 3 years. 3 years, after 3 years, myelosuppression was tested, all the leukemia parameters were tested, myelodysplastic syndrome blasts were tested, all were cured. He was clinically free from cancer without any conventional therapies, without any modern intervention, without anything. See, these two patients have the same disease, or basic disease was the same, but both of them had different Rishta Samprapti. Hence, choice of drug, choice of treatment has to be individualistically personalized so that the treatment is precise and it affects or cures the patient in time. See, the Vaidya is a bridge between God and human. The Vaidya is the one who builds a bridge between cure and God. Unless that bridge is absolutely, particularly precise, it will be broken off. That is why Samprapti Vigadanam Chikitsa or precision medicine is the basis of Ayurveda. Ayurveda has practiced individualistic precision medicine since ages. You all know that. And the another case I would like to mention is a very fresh case, which is Mr. Himakiran. He is suffering from non-Hodgkin's lymphoma. Lymphoma is nothing but the increased cancerous cells of lymphoblastic origin. You know, RBC, WBC, and WBC has lymphocytes, neutrophils, etc. Right? So when these neutrophils, lymphocytes increase in number, it is called lymphoma. 2 types of lymphoma are there: Hodgkin's and non-Hodgkin's. He was Himakiran. He was an organic farmer, a whole-scale organic farmer from Tamil Nadu. He's a very eminent personality, and he has played a very leadership role from Tamil Nadu in the farmers' strike in Delhi. So he came to me very recently, like 3 weeks, like a month back, and he was suffering from non-Hodgkin's lymphoma, particularly a type called the gastric lymphoma, which is very, very rare. The lymphocytes or lymph nodes in the mesentery of the gastrus around the intestinal area got filled with cancerous cells, and he was having severe abdominal problems and other issues. He was affected with COVID as well, and he did chemotherapy for a non-Hodgkin's lymphoma. After chemotherapy, what happens is he started uncontrolled dysentery and diarrhea. Daily 10 to 15 bouts of watery reddish stool. He couldn't do chemotherapy afterwards. They discharged him. They couldn't do anything with proper. The dietitians tried, the gastritis enterologist tried, the oncologist tried, everybody tried, but he was having bloody diarrhea throughout the day. By 10, he'll go to sleep by 10 and get up 10 times, 12 times at night for passing watery stool, and he couldn't sleep. He, from 90 kgs, he became 55 kgs in 3 months, 4 months. This was the stage when he approached me. He was having 6 months of bloody stools. And we started him with treatment. And after, and all cancer patients, I advise for a gluten-free, vegan, dairy-free diet. For every cancer and autoimmune patients, it is mandatory to have a gluten-free, dairy-free, vegetarian diet. He was given a gluten-free, mandatory vegan diet, and we started medicines for him. And here the roga is Pandu Grandhi is the Pradhana roga, and he was going towards Grahani Rishta. And when you examine his anus, you can see he had, because of the increased bouts and pressure of this release of stools, his bile mass and the anus were all, came out inflamed, and it was all enlarged. And we started treatment. We started Pitta Grahani Chikitsa. I had told you, right? Pitta Grahani and Tatpeyam, Ushtoktam Tiktakam Chayat. Here we couldn't give Grida at first because we wouldn't digest Grida. So we give Mahatiktaka Kashayam tablet. Along with, it is especially mentioned in Paitika Grahani, you should give Grahi Deepana and Paitika and Tikta Resa Churna and in Akashayas in Paitika Grahani. So Nimbadi Churna along with Dadi Mashtaga with Grahini Mastudan Dosham, Ajirnavat Tubajare, Adisarokta Vidina Tasyamam Cha Vipaje. Once you have corrected Amam, you should give Adisarokta Chikilsa as well as Pitta Grahini Chikilsa. That is why Dadi Mashtaga Churna, half teaspoon, along with Nimbadi Churna was given twice daily before food, as well as Mahatiktaka Kashayan tablet was given thrice daily. Then he was started with 5 drops of Tikta Grida with Peya, quarter glass of gruel before lunch, and then Abraga Basma with honey was started. In 5 days, his bloody diarrhea stopped, and in a week, his completely bout of bloody stools and diarrhea was completely stopped. His stool normalized, and he was sleeping properly. He told to me after a week, like, doctor, you don't know what I have been through all these 6 months. I had never slept peacefully in the past 6 months, and I have hoped or prayed that I could see proper normal colored stools again. After 1 week of our treatment, he was cleared of bloody stools and diarrhea, as well as Pittaka Grahani Lakshana, as well as Arsha Chikilsa. He was given Anuvasana with the Pippalya, the Anuvasana Taila and Madhugadi Taila. Externally, he was given Pidichil with Kshirabala, and Guluchya, the Takradhara was given for head. And after 2 weeks, we started Arbuda Hara Chikilsa as well, because Arbuda lymphoma is his main problem. So we started with Sanjeevani Vadi. Sanjeevani Vadi is Mrita Sanjeevani Vadi, said in Vaishajya Ratnavali Chikilsa. That is Mrita Sanjeevani Arishta Kalpana. We use Mrita Sanjeevani Vadi along with the Swarna Basma to be given to him. And he is now on that as well. And he is improving quite drastically. He is improving in weight, and he's slept quite fantastically, and he is absolutely fine and happy. See, this is how we treat patients having cancers and autoimmune diseases in Ayurveda. Ayurveda is a Siddhanta. What is a Siddhanta? Siddhanto namasyat parikshagai bahuvidha parikshagai hetuvischa sadhayitva stapyadi nirnayaga. Siddhanta is something that is proved over time by trial and error in accordance with karya karanatva. Ayurveda is a Siddhanta. Learn this Siddhanta. How you understand Ayurveda Siddhanta? Siddham Agama Siddhatval Pratyaksha Phala Darshanad. We understand the Siddhanta by observing the Pratyaksha Phala Darshanad. We understand the Siddhanta, we understand the Lakshana, we understand the Samprapti. According to Samprapti Vigadana, we give medicine to the patient. And how do you understand this is working? Pratyaksha Phala Darshanad. You see Ryan is alive. You see Manav is alive. You see Himakiran is alive. By giving these precision medicines according to the Samprapti of the patient. Pratyaksha Phala Darshanad. That is how you understand Ayurveda Siddhanta. There is a particular difference between protocol-based treatment and precision therapy. For the past 20 to 30 years, we have been running towards protocol-based treatment. You see many PhD and PG scholars as well as professors visit me for their theses as well as to help them with their PhD theses and PG theses. And all of them, you see, when you see a PG thesis, it will be like effect of Gugulu Tikta Grida in Vadarekta. So what they do is they give Gugulu Tikta Grida or this Gugulu Tikta Kashaya for Vadarekta or rheumatoid arthritis. 100 patients, same medicine, and they take the statistical value of the disease. This is not possible in Ayurveda. Ayurveda is not programmed for same medicine for 100 people. That is not how Ayurveda is programmed. In autoimmune and other diseases, each person has to be treated individually according to his Samprapti. Just imagine a Vadarakta Rogi giving all Vadarakta Rogi Gugulu Dikta. One type of research. Another type of research, we take each individual Vadarakta Rogi. Each Vadarakta Rogi or arthritis patient may have a piles, a thyroiditis, or other gastritis, different other Vyadhi Sampraptis. We take into account each Vyadhi Samprapti, each Vadarakta Samprapti. We analyze the patient according to his genetics as well as his habits and give proper treatment to each 100 patients differently. Then we take the data. Then we compare the data. That is how we do Ayurveda treatment. But unfortunately, Ayurveda research is done only for protocol-based treatment and not for precision medicine. Precision medicine is now the #1 form of treatment in the cream of the world, the Mayo Clinic, the Harvards, where they treat individualistic according to genetic treatment. That is how they do it. We just blindly follow the community medicine protocol. Any Ayurveda college you go, the children or students are taught a particular protocol for backache or migraine, or and the students by heart this protocol. And when they come to real life, what happens is they get a migraine case, and they have studied like a few drugs for migraine, like Patyaksha Datriyadi, or some patent medicines like Migracor or Eastagrade, or some patent medicine. They by heart a protocol that is taught in their respective institutions. And when a patient comes, they blindly give this Migracor to a migraine patient. What happens is, this is fine. It's fine. What happens when that Rogi migraine doesn't get reduced? Then you are trapped because you don't have any other option. You have a fixed protocol, you have a fixed group of medicines, and you only know to treat the name of the disease and not the disease. That is the biggest problem facing Ayurveda right now. Ayurveda is person-oriented. It is Vaidya-oriented. Better the Vaidya, better the treatment. That is because it is individualistic. You know, You cannot treat 100 patients with the same medicine. That is stupidness. But that is what we are doing as a research. We can do community-based research, for virus, all other community-based medicine. But for autoimmune nijarogas, we need protocol-based, individualistic, protocol-based samprapti vikatanam chikitsa. Unfortunately, there are only very few physicians in the world who can do samprapti vikatanam chikitsa, who understand Ayurveda properly, who can teach students samprapti vikatanam chikitsa, and who can show siddhyam agama siddhatval pratyaksha phala darshanad. There are only very few left in this world who can actually do this. The problem with treating migraine, as I said, with the same disease is that just imagine two conditions of migraine. Two working women. One woman had a late night. She was watching Netflix or doing scrolling. Both of them had bad sleep. Got up early, went for work. Didn't have breakfast. And one lady A took 11 o'clock. She took an egg puffs or some egg puffs or a pizza at 11 o'clock. And the other woman B didn't take any food. And they were walking back to their home in the sun. And once they reached home, their migraine bout started. Number one, patient A started migraine. She had gastric distress as well. It was initiated due to the ama or inflammation created in her gut, which initiated migraine, which caused her migraine bout. Whereas the patient B, she had a vada paitika samprapti, right? She didn't sleep, she didn't eat food, she was walking around in the sun without eating food, and her migraine bout started. How can you give Migracor or same medicine to both patients? That is what we are doing right now. That is not possible. In the first patient, we have to give Divapna Pachana Chikitsa so that her ama is reduced. And once you give the Mahatikta, Dhanvantara or Sudarshana or Panchagola, ama Pachana happens, her migraine disappears. And for the second patient, it is Vada Paitika Samprapti. It is Surya Varta Vada Paitika Samprapti. There you have to give Peya. You can give gruel with a bit of ghee or Drakshadi Fanda with Kshirabala. Completely different treatment, completely different Samprapti, same disease, migraine. This is how you treat in Ayurveda. See, Ayurveda is like relativity. You know, there are people who understand relativity, and there are people who will never understand relativity. Similarly, in Ayurveda, there are people who will understand Ayurveda, and there are people who will never understand or can comprehend the depth of Ayurveda. When you, we live in a three-dimensional world, but our eyes can see only in two dimensions. You can perceive my length, your eyes can perceive my length, your eyes can perceive my width, but your eyes cannot perceive my depth. This depth perception is a trickery that the brain plays by image contrast. This is individual perception. See, when you have, everybody has individualistic perceptions of reality. This is how Ayurveda works. Many of you might have seen the Hollywood movie Matrix. Whatever happens in the Matrix translates in the real world. That is how Ayurveda translates. The Lakshana, the Samprapti, the habits of the person is what translates as Siddhanta. Whatever Lakshana Samprapti said in Siddhanta, it reflects in the Lakshana Samprapti and Drishta of the individualistic person. That is how Ayurveda works. Yatha Pakshi Paripadan Sarvadam Sarvamapyaha. Wherever the bird goes, the shadow travels with it. This is how relativity and Ayurveda works. We can see this vast horizon of Samprapti Vigadana such clearly because we stand in the shoulders of giants like Dr. P.K. Warrior, Thirimul sir, or Rajagopalan, Dr. Rajagopalan sir, Padmasri, my grandfather. All these amenities are advocates of precision medicine or Samprapti Vigadanam Chikilsa. It is a specialized method of treating in Ayurveda. That is how they have accomplished such miracles through treatment. It is difficult to understand, difficult to comprehend, difficult to teach, but it is possible. Right? See, I always say, there are no bad students. There are only bad teachers. There are no bad juniors. There are only bad seniors. There are no bad children in the world. There are only bad parents. Hope we can work together to heal this place. After all, Ayurveda is the science of life. Let's hope we together can heal more patients suffering from cancer and other chronic diseases by this wonderful Shastra. Thank you. Hope you guys have understood the concept.
Thank you, sir. Thank you, sir. Dear participants, if you have any doubts or questions, please raise your hand or type in the chat box.
Like, can we speak?
Dear participants, yeah, sure.
Okay. Like, I directly, like, I just, Rajagopal, I'm Mausmi here.
Yeah, please. Mausmi Chechi, Parayu.
So happy to hear you. ഞാൻ ആദ്യമായിട്ടാണ് നീ സംസാരിക്കുന്നത് കേൾക്കുന്നത്. വളരെ സന്തോഷം എന്ന് പറയാൻ പറ്റുമെങ്കിൽ ഇപ്പൊ അങ്ങ് വന്ന് നിന്നെ കണ്ടേനെ. Like, I wanted to tell this in public. That is why all those who are listening, like, this is like he has made it himself, അല്ലേ? സ്വന്തം ഉണ്ടാക്കിയതാണ്. അതൊരു മനുഷ്യന് ഇത്രയും പറ്റുമെങ്കിൽ each and every one of us can do it, അല്ലേ? You are really an inspiration. അത് ഇത്രയും ആൾക്കാരെ മുന്നിൽ വെച്ചിട്ട് തന്നെ പറയണം തോന്നിയതുകൊണ്ടാണ്. അത് മുറിഞ്ഞാണ് ഞാൻ കേട്ടത്. I couldn't hear it completely though, but almost I could, like, almost I heard it, and so happy. So anyway, thank you, and like, sky is your limit and beyond it, അല്ലേ? You go ahead. എല്ലാ എന്താ പറയാ, ഒരുപാട് സന്തോഷം. Anyway, ഇത്രേ പറയാനുള്ളൂ.
Oh, so grateful to hear from you, Mausmi Chechi. She was my senior at Kotakil when we studied. When I was doing UG, Dr. Mausmi was a PG scholar in Kotakil, and we had such a great time in Kotakil. I am so happy you were here listening to this. So
happy. So, like, I kept the phone live, and like I was going on telling to my father, like, he was a junior there, and like ഇതിൽ വലിയൊരു സന്തോഷം ഉണ്ടോ ഇങ്ങനെ സംസാരിച്ച് കേൾക്കണതിൽ. അപ്പം അതാണ് like ആ വികാരം. Anyway, like, so happy. You go ahead. എന്താ പറയാ, ദൈവം നിന്റെ കൂടെ. സന്തോഷം. Okay, then let people ask doubts. I'm not spoiling your time anyway. Thank you so much. Bye.
Hello, sir.
Yeah, please.
So there is a question in the chat box.
Yeah.
So shall I read, sir? Sir, there's a question from Dr. Jayshankar.
Okay.
So say about pro-inflammatory diet and more.
Like he want to know about pro-inflammatory diet. That is what the question is.
Yes, sir.
Okay. See, pro-inflammatory, as I said, there are 3 types of foods that causes inflammation in the body. One is gluten containing foods. Second is red meat containing foods. And third is dairy containing foods. All these 3 causes inflammation in the body or causes inflammation in the gut, as I have mentioned. What we actually practice in cancer treatment is you do not use gluten containing foods like wheat, barley, or the maida, atta, etc. We go for a multi-grain whole grain diet, which includes rice, millets, ragi, etc. As well as completely avoid red meat. Instead, for an omnivore diet, you can prefer desi, like the desi chicken, or the, what do you say, the smaller bird, kada. I don't know I forgot the English of kada. And as well as dairy products. When you are using, as you know, it's a nitya rasayana, right? Said in Charaga, what kshira is a nitya rasayana. But the problem with kshira is the amount of fat, lactose, and antibiotics in kshira is constantly acting as a vajra in the intestine. You also know Acharya prescribes kshira with 4 times diluted milk, 4 times diluted water. So if you're taking milk, go for milk that is cow that is having organic feeds near your house, cows, organic feeds without antibiotics, and properly diluted milk. And avoid milk if you are having allergy conditions, skin disorders, and other autoimmune disorders. Thank you.
Thank you, sir. So next question by Dr. Sir,
Yeah.
please discuss about patya and apatya.
Patya and apatya. Yeah, see, the basic patya for a normal human being for a sustained life or ayus is properly mentioned in Kushta. Ashtanga Kushta mentions the diet for a Kushta Rogi in Ashtanga. Patya, what I would suggest is, what is a balanced diet? Balanced diet is group of foods that does not cause inflammation in the body, and it is maintained in accordance to the health, personal health, and cultural conditioning of the individual. See, you cannot ask when you treat a person from North India. When I say a gluten-free diet, he'll be like, oh my God, gluten-free diet, what am I supposed to eat? See, the problem is culturally, we are so much adapted to a particular lifestyle. Avoiding these 3 inflammatory things, the gluten, red meat, as well as dairy, is patya for everyone. But individually, you can regulate this. Like you can have a cheat day once in a while. That is fine. I'm not telling that you should avoid all things and stop. You do it in a regulated manner. You don't eat gluten daily. Do not ever eat red meat daily, and do not ever take dairy daily. That is the only thing you need to take care of. Eat only 80% or 60% of your diet that is called hara hachibu. It is a Japanese term said in Ikigai. You guys should read Ikigai. Ikigai is a wonderful text, and it's in line. The Japanese culture of diet is in line with Ayurvedic diet. In Japanese culture, they say 80% of wire is full. Of the 80% of stomach, it's full. In Ayurveda, it's 75%, right? The rest you should feed, and you should take only mitahara or light food. They are also mitahara. In any centenarian diet in Japan, Japanese culture has the highest, centenarians, above 900 years people. And Japanese diet, they do not have gluten, red meat, or dairy. They have rice, Mediterranean fish, as well as chicken, and minimum dairy with soya milk and jasmine tea. You can opt for like soya milk, coconut milk, almond milk. You can go for tea as well, different types of tea, the green tea, jasmine tea, all that. Thank you.
Thank you, sir. Sir, one more question by Dr. Arpita.
Yeah.
Sir, use of Swarna Bhasma and role of Panchakarma treatment here.
In cancer?
Yes, sir.
Okay, first I'll come to Panchakarma treatment. See, Panchakarma treatment is mentioned for only if the disease is Balava, Rogi and Roga are Balavan, then you can go for Panchakarma treatment in any autoimmune disease. 90% of cancer patients, you cannot do full-fledged Shodhana, but you can do Mrudu Virejana as well as Mrudu Shodhana and Mrudu like Anuvasana, Matravasti, etc. But full-fledged Panchakarma Chikilsa is not practical in cancer rogis having deficient rogi bala. But you can use Mrudu Shodhana to purify the cancer rogi, so that you can start, you can do Mrudu Shodhana and then start a Rasayana therapy. Rasayana therapy, like the first part of the question, Swarna Bhasma, right? Swarna Bhasma, Swarna, Draksha and Amalaki are prescribed by Sushruta to be given to all rogas having Rishta Samprapti. When you see Rishta Samprapti Rogi, Sushruta particularly mentions three things: Amla, Draksha and Swarna. Swarna Bhasma to be given to diseases that are uncurable or diseases which you do not understand, or when the patient is going to die or has Rishta. One particular mention about Swarna Bhasma is Swarna Bhasma as well as Loha Bhasma. Loha Bhasma, you shouldn't give Loha Bhasma to patients who are doing continuous blood transfusion, because when there is a continuous blood transfusion, it causes increased amount of serum ferritin or the iron in the blood. So you shouldn't give Swarna Bhasma as well as Loha Bhasma in patients with liver related issues or liver load. In all other cancers, especially as a Rasayana and for Agni Deepana, as well as like Rasa Shuddhi and Hridaya Shuddhi. As I said, Pandu, Kamala are all Pitta Pradhana Roga, right? Pitta Sthana, Sadhaka, see, when you see Pandu Samprapti, you know, like Pitta Pradhana Kubita, Yatokter, Tobaner Mala, Tatra Anilena, Balinaha Chiptam, Pittam, Hridistidam. The Hridistida Pitta is vitiated, or Sadhaka Pitta along with Vyana Vayu is vitiated. So whenever there is Vyana Vayu Dushti and Sadhaka Pitta Dushti, or in increased Pandu Samprapti, when you see the treatment of Vesha in Ashtanga Sangraha and Ashtanga Hridaya, for a treatment of Vesha or Hridaya Shodhana, you use Tamra Bhasma and Swarna Bhasma. That is because of his this particular property of Swarna Bhasma to clear off or pacify Vyana Vayu, Sadhaka Pitta, as well as Prana Udana functioning. So for neurological prana udana benefits as well as sadhaka hridaya shuddhi, including unmada and grahani, paitika unmada and grahani and pandu, Swarna Bhasma is very much effective. Similarly is Siddha Magaradhwaja. Siddha Magaradhwaja has a more Vyana inducing property, Vyana, Udana, Anilomana than Swarna Bhasma itself. That is why when you can give Siddha Magaradhwaja in cases of low BP, high BP or heart related issues, and you see the BP coming down very fast. This is because of the Vyana, Udana, Sadhaka, Pitta relieving properties of Siddha Magaradhwaja and Hema Bhasma. Siddha Magaradhwaja has more Vyana releasing property than Hema Bhasma. Thank you.
Thank you, sir. And there is one more question by Dr. Arpita. Sir, any Bahir Parimarjana Chikitsa?
Please, once more.
Sir, is there any Bahir Parimarjana Chikitsa?
Bahi Parimarjana. Yeah, Bahya Parimarjana Chikitsa, you can use anything. Like, what you say, for a particular Arbuda, if you are giving, like in Stana Arbuda, or if there is a particular lesion, you can use all Bahya Kriyas, like Lepa or Thara. But in Stana Arbuda and in Brana, particularly see, like in Kashyapa, that is where Kashyapa, in Stana Gilaga Chikitsa and Stana Vitradi Chikitsa, Kashyapa truly mentions Shida Sega, right? Sega, where Shida Thara has to be used. Just in Stana Chikitsa, Shida Thara has to be used, and in Pitta Pradhana Chikitsa as well, use Bahya Parimarjana Kriya as Shida Kriya will be beneficial in Arbuda Chikitsa. You can use all Bahya Parimarjana Chikitsas like Leva, everything in Arbuda. It's not a problem. But you have to be careful with the lesion itself. If you are not sure how metastatically active the lesion is, how the wound is, like in certain types of skin cancers, with metastasis, Bahya Parimarjana Chikitsa can cause complications of bleeding or even increased pain, etc. So unless you are experienced with those kind of treatments, I suggest you go for very conservative management. Okay, thank you.
Thank you, sir. And sir, dosage of Bhasmas.
Dosage of Bhasmas.
Sir, dosage of, yes, sir.
Or like, okay, I'll just like, it's impossible to tell the dosage of Bhasmas to every individual and every Bhasma because it varies, you know. Like Swarna Bhasma for a cancer patient with good digestion and no other probabilities, you can give 50 milligram of Swarna Bhasma. Whereas Loha Bhasma, you can give 150 milligram for a Pandurogi. Abraga Swarna Makshika Bhasma, also you can give 100 mg, 100 mg, up to 200 mg, it's fine. Rasa Sindura also 200 mg is fine for a cancer rogi if diet is adhered and there is no Pitta Pradhana rogas. So the Bhasma, the dose of Bhasma varies according to the prognostic features of the individual as well as the condition. Thank you.
Thank you, sir. Dear participants, if you have any doubts or questions, you can directly ask or type in the chat box.
Hello.
Yeah.
Hello, Dr. Rajagopal. I'm Dr. Shruti Pandit. Lakshmi Ji's friend.
Yes, parayu.
I'm from Kasaragod. അപ്പം ഒരു 2-month-old baby ഇല്ലേ, അപ്പം ആ ചെറിയ കുഞ്ഞിന് അപ്പൊ എങ്ങനെയായിരുന്നു, ഞാൻ ഇടയ്ക്ക് ബ്രേക്കപ്പ് ആയതുകൊണ്ട് എനിക്ക് കൃത്യമായിട്ട് കേൾക്കാൻ പറ്റിയില്ല ഡോക്ടർ. അപ്പൊ ആ കുട്ടിക്ക് എങ്ങനെയായിരുന്നു ഘൃതം, അതൊക്കെ എങ്ങനെയായിരുന്നു അഡ്മിനിസ്റ്റർ ചെയ്തത്? ചെറിയ ബേബി അല്ലേ?
ഘൃതം നമുക്ക് സ്വാദു ഘൃതം എന്താ, ഇറ്റ്സ് ആജന്മ സാധ്യമാണ് ഘൃതം അല്ലേ? ഘൃതം ഡയറി പ്രോഡക്റ്റ് ആയതുകൊണ്ട് ഉപയോഗിക്കാമോ എന്നുള്ളതാണോ യുവർ ഡൗട്ട്, റൈറ്റ്?
അങ്ങനെയാണ്. പിന്നെ ചെറിയ 2 months വരുമ്പോൾ നമ്മൾ ബ്രസ്റ്റ് ഫീഡിങ് മാത്രം പറയുന്നില്ല. അപ്പം ഘൃതം ഡൈജസ്റ്റ് ആവോ, പിന്നെ അത് പാലറ്റബിൾ ആവോ, അങ്ങനെ ഒരുപാട് ക്വസ്റ്റ്യൻസ് ഉണ്ടല്ലോ. അപ്പോ അങ്ങനെ
See, rule number 1, ഘൃതം ജനിച്ചപ്പം തൊട്ട് കൊടുക്കാൻ പറ്റുന്ന ഘൃതം can be used from the day or from the initial period of a baby. Ghridam can be given in minimal doses as a nityahara. It's not a problem because even in Stanakilaka Chikitsa or in breastfeeding mothers with inflammatory breast, you advise to add Ghrida on the nipples and do breastfeed, right? So the thing with Ghrida and cancer patients is, even if you are 2-month-old, why you are a 2-month-old baby, all you have to do is to properly dose the Ghrida. If you are having Agni-mandya and Advagni-mandya, you have to dose the Ghrida according to the cancer patient. That is why I said before, there is no anupasaya in cancer. You have to be precise with the dose. If you increase the dose, the kid or the cancer patient will have ama and ama related ajirna, and ajirna related aggravation of symptoms sometimes causes rishta and death. But in this 2-month-old baby, Ghrida was given only 1/4 teaspoon of Kalyana Ghrida, less than 1/4 teaspoon. Actually, we say leha, like take a finger, dip it in Ghrida and ask the kid to lick the Ghrida along with the other medicines. That is how we administer Ghrida to babies. Giving Ghrida to babies or patients, only you have to do is check with minimal dose. If the patient is tolerating Ghrida or if he shows any inflammatory reactions to the Ghrida, that is all. If the patient doesn't show any inflammatory reactions, you can administer Ghrida safely to any age group.
Thank you, doctor. So I feel so proud to hear you. Lakshmi പറഞ്ഞു ഒരു
One more thing, like you might doubt why I am saying you shouldn't take dairy products like milk, curd, and paneer, etc., and you can take Ghrida, right? There is a contradiction. Both come from dairy, right?
yes.
Yeah, the contradiction is in Ghrida, after the processing of Ghrida, there is no lactose or other impurities. It is all cleared out due to the heating process and bhavana kalpana. So Ghrida is safe from lactose and other things, and it is pure cholesterol. So it's yogavahi and it's easily digestible in small quantities.
Okay, doctor. Thank you so much.
Sure. I hope all the doubts are cleared and all of you guys have enjoyed the session. I have another meet. I have to go now. I have another family function now. Actually, I'm late by half an hour. So hope we can conclude it now, hopefully.
Yes, sir.
Yes, sir.
But that 2 മണിക്കൂർ കൂടുതലായി, sir.
Yeah, I am tired too. I am hungry.
Okay. സാധാരണ 1 മണിക്കൂറാണ് മാക്സിമം. സാർ ഇത്രയും സിൻസിയർ ആയിട്ട് നിൽക്കുമ്പോൾ നമ്മൾ സ്റ്റോപ്പ് ചെയ്തില്ലെന്നുള്ളതേ ഉള്ളൂ.
Yeah, sure.
Thank you. ഐശ്വര്യ, conclude ചെയ്തു.
Yes, sir. Okay, sir. So at the end of this session, on behalf of ISM and GDH Varkala, I'm very hearty gratitude to our faculty, Dr. Rajagopal sir, for sharing this enlightening session with us. Thank you so much, sir.
I thank ISM, Dr. Ashwati, and everybody involved for this opportunity. And I really hope you have enjoyed the class without any problems, and hope you understand and propagate Ayurveda the way you do. Thank you.
Okay, sir. Good night.
Good night.
Thank you, sir. And once again, I thank all the participants presented here.
Okay, thank you all.